Today we'll be discussing the topic of snakes, and the very first thing to be discussed is the differences of the poisonous and the non-poisonous snakes. The very first point to be noted are the body scales. Like for example, if the victim who has been bit can bring along a dead snake along with himself for the doctor to tell that this snake bit him, or if he got a glimpse of the snake, he might be lucky enough to note a few differences. So that's why these differences need to be elucidated here. Number one, the body scales. And these are observed by turning the belly upwards. In case of a poisonous snake, they are large and cover the entire breadth of the belly. Whereas in non-poisonous snakes, they are small or they might be moderately large. However, they do not cover the entire breadth of the belly. Secondly, head scales are to be observed. They are usually small, but some poisonous snakes might have large head scales. But in case of non-poisonous snakes, the head scales are by and large large. Commenting on the fangs, they are long and canalized like hypodermic needles, especially in case of viper snakes, whereas they are short and solid in case of non-poisonous snakes. Tail is compressed in poisonous snakes and it's not markedly compressed in non-poisonous snakes. Habits. They are generally nocturnal of the poisonous snakes. The reason being, they prefer to hunt at the night time when it is dark and when it is cold. The reason being that they can appreciate the infrared heat emitting out of their victim. So what their vision is of their victim or prey is what the infrared heat tells them, and that is more appreciated in a cold, dark night. And in case of non-poisonous snakes, there are no particular habits for hunting. Finally, coming on to the bite. In case of a poisonous snake, there might be two fang marks, there might be a single fang mark due to involvement of a cloth that the other fang hit the clothes of the individual. However, there are two fang marks with or without small marks of other teeth. Whereas in case of a non-poisonous snake, there are a number of small teeth marks in a row, usually leaving a U-shaped impression of the bite. So if an individual comes to you, that the victim of a snake bite is coming to you, and you see and observe the number of small teeth that are of U-shape, immediately you can tell the patient that he has been bit by a non-poisonous snake. Only this much of a consolation is going to calm that individual and save that individual's life. Next, coming on to the venom effects, and in that case, all three different kinds of poisonous snakes, that is the elapids, vipers, and sea snakes, they have different sort of venom. To begin with, the neurotoxic venom of the elapid, it acts on the nervous system and the brain, and it paralyzes the skeletal muscles as well as the respiratory muscles, leading to death. The hemotoxic venom of the vipers has a twofold action. It acts on the heart and the cardiovascular system, but it also has a cytotoxic effect which has a localized action at the site of bite. So a very prominent localized effect of the snake bite is indicative of a viper bite. Thirdly, the myotoxic venom of the sea snakes, the most important symptoms are rhabdomyolysis, that is the rapid breakdown of the skeletal tissue and the paralysis. In case of elapids as well as sea snakes, the bites are very minute with very little or no local reaction. There could only be a couple of fang marks and that's it. However, in case of viper, there is a massive cytotoxic localized reaction also that is easy for you to identify and treat the patient accordingly. Now, what happens here is that the important point to be emphasized here is that many snakes incorporate both neurotoxic and hemotoxic venom in their bites. So, when telling them apart, one goes by which type is more predominant. Thank you.